hospital began over 100 years ago. It was started by some concerned citizens here in the community who had a real commitment to providing quality health care service in this region. For the last 100+ years, Little Falls Hospital has been a primary source of health care in this community, and as the years have gone on, it's taken a larger role as other hospitals in the area have closed.
Little Falls Hospital is small enough to be personable as far as knowing our patients. It's small enough that I'm able to interact with all of the primary care providers that refer our patients. Yet, it's large enough to provide a wide range of care, including surgeries and including outpatient procedures, which we do quite regularly. And I also feel really well supported by Bassett Health Care Network, Cooperstown, as a regional backup. The benefit of having Little Falls here in our community is that if you were to become ill and unfortunately require hospitalization, you'd have the opportunity to get better close to home. One of the unique things that we really do, and we pride ourselves on this, is to keep our families involved in the care of the patients in the hospital. Familial support, of course, with the patient's permission, is more important to ensure their success once they're discharged and staying out of the hospital and going on with their lives independently. So not only involving the primary care provider, but it's also the families.
We have a state-of-the-art radiology department. We have a brand new full-field digital mammography. We just added MRI services here, 40-slice CAT scan, full-field digital x-ray room that we just put in this year. We also offer a variety of ambulatory same-day surgeries, hernia repairs, tonsillectomies, ear tubes, knee arthroscopies, shoulder arthroscopies. If you come here with one of the higher level of cares, you'll be transferred to a bigger center, Bassett, but we do the initial care to stabilize the patient before they are transferred. We also offer wellness programs that range from the wellness program in the PT department. That's where people come in and use the equipment as if you would be going to the YMCA. We have adult daycare. We have 12 chair dialysis unit that just was added. We offer lunch and learns where we have lunch and have a speaker come in and talk about various things such as blood pressure, knowing your numbers for your cholesterol, different types of programs for people to monitor their own health care.
On an average day here in the emergency department, we can see everything from a diabetic emergency to pneumonia to a minor laceration, and on the more critical side, a heart attack or a stroke.
As the needs of the community have changed, so has the operation of the hospital. As a major institution in the Valley, the hospital is a major employer. We employ several hundred people, from doctors and administrative professionals to clericals and maintenance workers and technicians and everybody in between. Our payroll is in the millions of dollars, tens of millions of dollars, as is our annual operating budget. So the annual economic impact of the hospital probably close to $50, $60, $70 million a year, and that'd probably be direct dollars. If you used an economic multiplier, as most economic development agencies do, we'd be well into the hundreds of millions of dollars of economic impact a year.
It's important to realize that when patients come into the hospital, they're cared for more than just the hospital physician. It's a team that delivers care to the patient, which will include physical therapy, occupational therapy, nutrition consultation, case management, and actually a unique feature that we do offer is our subacute hospital program, which allow patients that would require a little extended time to recover. It gives them the opportunity to finish their rehabilitation here in a hospital setting. A lot of people don't realize that they have this facility in their backyard. I don't think they realize that we've tried very hard to update our facilities, particularly over the last 2 years, acquiring MRI scanner, updating our CT scanner, providing full laboratory services, full inpatient services, also providing the link to Bassett Health Care Network, and also realizing that if patients come here that they do have a choice for their care.
We put a premium on quality so that our patients can feel safe, we can feel assured that our neighbors are getting the best quality care they can have.
Everybody here works as a team, right from administration to middle management to the nursing staff, the clerical staff, the housekeeping. Everybody pulls together.
The greatest thing about being a nurse, especially being a nurse here at Little Falls Hospital, is being able to give back to your community. I have, over the years, taken care of so many people that I know, and it is so rewarding.
The compassion is just overwhelming. There's something to be said coming from a small town and having a hospital in a small town. People feel comfortable. They feel cared for. They feel loved.
I've been a lifelong resident of this area. I intend to live here the rest of my days. When I get sick, I want to know that the Little Falls Hospital is here. What we've done here is we've ensured that presence for over 35,000 people that live in this area. And that's a real important thing to have, is a good quality hospital in your community.